Today, we will give a quick update on the situation of the COVID-19 pandemic, as well as make some adjustments to our medical protocol to streamline the process, as well as expand our booster program. Since our last press conference, the number of Omicron cases have risen rapidly, especially over the last few days. Now, the Ministry of Health can ascertain about 70% of daily cases to be Omicron, but in reality, the proportion is likely to be higher, perhaps close to 90% or more. Omicron has clearly dominated over Delta variant in Singapore. Given the Omicron variant is more infectious, it is likely that we will soon see a significant wave. So far, most of the Omicron cases have been mild, especially among those who have been fully vaccinated, and even more so for those who have received a booster shot. The percentage of those who needed oxygen supplementation, intensive care, or die is far lower than during the Delta wave. This is in line with the experience of other countries like South Africa and the United Kingdom. Minister Ong will elaborate further. However, we should remain vigilant, especially during the Chinese New Year festive season. The safe management measures we have put in place will help to lower the risk of transmission and reduce the stress on our healthcare system. We will maintain our current SMMs for now. As we ride through the Omicron wave, we must be prepared that a significant proportion of our workforce may be infected with COVID-19. If we have, for example, 15,000 cases a day, which is very possible, with each one of them out of action for an average of, say, about 5 days, we are looking at some 75,000 workers absent due to COVID-19. If we include those who are close contacts and have to isolate themselves, the number will be much higher, and they may be concentrated in certain companies or specific sectors. Services may therefore be disrupted from time to time. This has been the experience of other countries, and we cannot take it lightly. Hence, businesses should put in place robust business continuity plans to mitigate disruptions to business operations, particularly those in the essential services. They should also adhere to the workplace SMMs and encourage employees to self-test regularly to minimize workplace transmission and protect their fellow workers. We will also streamline the testing requirements for the VTL travelers. Currently, VTL travelers need to undergo supervised ARTs on days 3 and day 7 of their arrival. From 24th of January, we will remove this requirement. In other words, travelers will undergo unsupervised self-administered ARTs from days 2 to 7 of their arrival, only if they intend to leave their residence to go out, and their tests must test negative if they want to go out. This will allow us to focus our testing resources on the community in preparation for an expected spike in the case numbers. I would like to assure everyone that we remain committed to our journey towards living with COVID-19. I know that many of us are hoping for a relaxation in SMMs as we approach the Chinese New Year. However, it is important that we continue with our existing SMMs to help prevent overloading our healthcare system, even as we experience a surge in cases from Omicron, the variant. We will continue to take a careful, step-by-step approach to resuming more economic and social activities and do our best to avoid any disruptive U-turns. I would also like to remind ourselves and everyone to observe the SMMs, test yourselves regularly, and exercise social responsibility. For those who are eligible to receive your booster shot, please come forward to do so, as it will provide significantly stronger protection against serious illness. If we continue to work together, I'm confident we'll be able to navigate the upcoming Omicron wave and progress in our journey towards COVID resilience. Thank you.
Good afternoon. DMS, Kenneth, Mark, and I have quite a long presentation today. I will kick this off. I will take stock of 2021 and then talk about what more we will do to help us prepare for this Omicron wave that we are already in. What we are going to present will hold fast to a few key principles. First, we continue to aim to live with COVID-19, including the Omicron variant. Second, we must understand the variant scientifically so as to better shape our policies and responses. Third, very important, focus our energy and resources on the risk areas and on the vulnerable. It's very important once the wave becomes very big. And finally, count on everyone to do our part as a united national response. First, let me take stock of 2021. Difficult year, but fortunately we ended the year with a subsiding Delta wave. MOH has been compiling data on the incidence of infected individuals needing ICU care or dying, broken down by age and vaccination status. The media will recall we released this data twice last year, and now we have updated the number until the end of 2021. So that's why it's a stock take, and that whole year is pretty much all Delta variant. So this set of data, predominantly related to Delta variant, and now we are in the Omicron wave. So it is timely and useful to do this year-end stock take on the incidence rate of severe illnesses and deaths. The conclusion of the updated data set is consistent with our last two releases. Number one, unvaccinated individuals are at far higher risk of falling severely ill or die, and this increases especially with age. Number two, the chances of unvaccinated COVID-19 patients needing ICU care or dying is many times that of the fully vaccinated. It ranges from 7 times more for those aged 80 and above, and 50 times more for those in their 30s. Specifically, the chances of unvaccinated individuals falling severely ill or die are, for those in their 60s, 7.2%. For those in their 70s, 14%. For those 80 and above, 24%. And in contrast, for fully vaccinated individuals in their 80s, the corresponding percentage is only 3%. All these data will be compiled and will be presented as an annex to today's press release. I cited this data because I come across the argument of individuals who do not want to take COVID-19 vaccines that there should not be any VDS. There should not be any Vaccination Differentiated Safe Management Measures, the VDS. And their view is that the number of unvaccinated people in our population, not large to start with, and since only a small percentage, if infected, fall severely ill or die, the load on our healthcare system by the unvaccinated will not be significant. And we should therefore remove VDS and allow the unvaccinated free access to various premises. I want to just point out that based on all these numbers, as I say, the principle must be, our response must be scientifically backed up. And I want to point out that this argument is not correct. Throughout the pandemic, 2/3 of our ICU beds are occupied by people who are not fully vaccinated. And very likely for Omicron, it may turn out the same way. And if you look at the numbers, today we have about 120,000 adult individuals above the age of 20 who are unvaccinated. So these are unvaccinated adult population. And very few of them are due to medical ineligibility. Most are due to choice. Based on the incidence rate of severe illnesses and deaths that I just mentioned and presented, and the age profile of the current unvaccinated population, if all of them are infected with the Delta variant, we expect 5,800 of them to require ICU care or to die. 5,800 is not a small number. Remember, at the peak of Delta wave, our maximum ICU occupancy was 176, and this is 5,800. and 176 ICU beds occupied contributed to a severe strain on our healthcare system. Of course, in reality, not all unvaccinated persons will be infected, and for those who are, not all will be infected at the same time. However, even if, say, a quarter of the 5,800 ICU cases occur over a duration of 4, 6, 8 weeks, it will be a significant load on our healthcare system. A significant load enough to displace many patients suffering from acute complications of cancer or severe chronic diseases who may need urgent medical care. Enough load to consume a lot of costly COVID-19 therapeutics. Enough to degrade the overall quality of care of the healthcare system, which will ultimately affect everyone, especially those non-COVID patients who are critically ill. So, and all this can be avoided if unvaccinated individuals has chosen to take their jabs instead. Some may argue that my data and my analysis is based on Delta and Omicron is less severe. Indeed, from the experiences of other countries, we know that Omicron infections are much less severe for the vaccinated and boosted and for those who were infected and recovered. But we are not so sure that the same is true for individuals who are unvaccinated and COVID naive. We have not seen the full impact of the Omicron wave in Singapore, and now is not the right time to take a gamble to remove VDS on the hunch that Omicron may be less severe for the infected unvaccinated. We cannot gamble on the health of Singaporeans. And even if, hypothetically, someday the number of unvaccinated people falling severely ill because of COVID-19 infections works out to be a very low number and does not impact or burden the healthcare system excessively, remember, the credit goes to the rest of the population. The rest of the population, which is the great majority, chose to vaccinate themselves. A significant number, in fact, were worried about vaccinations too, but nevertheless, they decided to do their part for their family and for the society. And conversely, if everyone adopts the attitude that we need not get vaccinated because others will, and then we free ride on the rest, then our society will never have achieved the high level of resilience it has today. So the vaccination exercise for children is now ongoing. It is a teachable moment for them, and I hope we teach them the right lessons. It is important for children to get vaccinations. In countries experiencing Omicron waves, hospitals are seeing a sharp spike in pediatric admissions, mostly because children are not vaccinated. While the great majority of these children, they recover quickly, this is not something we can take lightly. DMS will explain this further. Now let me talk about the Omicron infection wave. It is all over the world and dominating the Delta variant, and this is already happening in Singapore. The good news is that our existing vaccines are working against the Omicron variant, and people are generally having less severe symptoms as compared to the Delta variant. And given that, we will be making a few further changes to our vaccine policies and our health protocols to further prepare ourselves to ride this Omicron wave. First, the expert committee, EC19V, has recommended, and MOH has accepted, that young people aged 12 to 17 can now receive boosters. Other countries such as US, Chile, Qatar, and Israel have already extended boosters to this age group. The EC19V has reviewed the data and is satisfied that boosters are safe and effective for individuals in this age group. We will progressively roll out booster vaccinations for this age group, and SMS invitations will be sent out to the 16 and 17-year-olds from early February onwards. Younger children or teenagers will then be invited gradually. With this change, the 270-day validity period for 2 shots of mRNA and 3 shots of Sinovac Sinopharm vaccine will be extended to those aged 12 to 17. But it will start later than the rest of the population. As you know, the rest of the population, this will kick in from 14 February 2022. For those aged 12 to 17, we will kick this off later, 1 more month later, on 14 March 2022. This will give the young people aged 12 to 17 more time to get their boosters. And in the meantime, if you are in this age group, you have received an SMS invitation to receive your booster shot, go and get a jab promptly. Second, we will further rationalize health protocols at the borders and in the community. Minister Gan has explained the changes for the travelers, so I will not repeat. Let me instead briefly talk about community health protocols. NCID studies show that while the Omicron variant is more transmissible, infected individuals carry a lower viral load and generally recover faster. We will therefore reduce isolation period for the fully vaccinated individuals and children under 12 years old from 10 days to 7 days. We will also allow for the wider application of Protocol 2. As you know, Protocol 2 is where individuals perform ART self-test, self-isolate 72 hours, and once you are AG minus, you can then go out and resume normal activities. It's important for us to make this move because that way we can handle this large wave without overburdening the health response system. And then medical care can go to those who need it the most. And Protocol 2 is based on personal responsibility and civic consciousness, and with the cooperation of Singaporeans, it has actually worked very well. These are quite detailed changes, and DMS will elaborate later. Third, we would have to change the case definition for daily reporting. It used to be that when you see a doctor, a GP, general practitioner, he can only order a PCR test if you are suspected to be infected with COVID-19. And if you are PCR positive, you are either sent to a medical facility, such as a hospital or a COVID treatment facility, or you are placed under home recovery program for 10 days. We are changing it to 7 days. Yeah. And this is essentially called Protocol 1. Essentially, GPs, primary care providers, they can only order Protocol 1. On 6 January this year, we changed this arrangement. We empowered our GPs and other medical providers to also be able to order Protocol 2 if they encounter a patient who might be of low risk and experiencing very mild symptoms or in fact no symptoms. So for simplicity, let's call this GP Protocol 2 cases. GP Protocol 2 cases. Last time GP can only do Protocol 1, so now they are GP Protocol 2 cases. This change makes a lot of sense. Because whether an individual undergoes Protocol 1 with a 10-day and now 7-day home recovery, or Protocol 2 with a 72-hour self-isolation, it should depend on the risk profile and the severity of the symptoms of the patient, not because whether he decides to go to a GP or he do a self-test. Yeah. Hence, under the new arrangement, GPs, medical providers, they will look at the patient, do a medical assessment, refer to MOH guidelines, and decide whether I prescribe him Protocol 1 or Protocol 2. And consistent with the ART self-test under Protocol 2, we had not been reporting the GP Protocol 2 cases in our daily updates. The numbers were not large, about 100 to 200 cases a day when we first started the arrangement on 6 January this year. However, as it becomes increasingly evident that Omicron is a less severe disease than Delta, GPs also started to see more and more mild Omicron cases, and they prescribe more and more Protocol 2 to these patients. Hence, GP Protocol 2 cases rose quickly to about 400-500 cases a day last week, and this week, over 1,000 cases a day. MOH has reviewed the situation and decided that it is better to include the GP Protocol 2 cases in our daily updates on infection numbers. It will give a better picture of the epidemic situation in Singapore and which part of the curve we are on. So in other words, the numbers that you've been reporting, it will be higher. But let me caveat that this is still not the full picture, and neither is it possible to get a full picture. This is because many cases with no symptoms and very mild symptoms remain undetected, and others may choose to self-test and self-administer Protocol 2, which is also not possible to be captured. This was the case during the Delta wave and is now more apparent with the Omicron wave because it's generally a milder disease. So we will therefore be releasing two numbers every day, one for infections confirmed by PCR tests, which is the number reported currently, and then another for the GP Protocol 2 cases. We will backdate the numbers to 6 January 2002, when GP started to order Protocol 2 for the purposes of calculating total number of infections in Singapore, as well as the week-on-week increase in infection numbers. So to satisfy your curiosity, with this new method, the week-on-week increase in cases will remain largely unchanged compared to now, at about 2.5. As Omicron has clearly dominated the current infection wave, MOH will also stop differentiating between Omicron and non-Omicron infections in our daily updates. This is a change in case definition and how statistics are compiled. In reality, the way we lead our life, the way we respond to the disease, nothing has changed. Only the statistics and the numbers have changed. So it does not change the actual epidemic situation we are experiencing. Over the past weeks, we have been living with COVID-19 and Omicron variant quite carefully and calmly, with a less restricted posture where we can meet in groups of 5. So this attitude should not change because of an adjustment in case definition and reporting methods. The fact is that with vaccinations working well and the Omicron variant being less severe, the top-line infection number is becoming less and less meaningful in our response to COVID-19. This top-line infection number comprises mostly people who are vaccinated, who are experiencing mild symptoms or no symptoms, which from a public health point of view is not something we should be overly concerned about. We watch it, but should not be overly concerned about. And this is an issue I discussed with WHO Director General Tedros last week when we were on Zoom call, and it was well acknowledged by him and his experts that in time, when we start to live normally with the disease, the world needs to move away from focusing on the top-line infection numbers. The more important statistics are in the bottom line. How many people are severely ill, needing oxygen supplementation? How many is in ICU care? How many died? To report to you the latest data, to date, of the 12,078 individuals confirmed infected with Omicron, and there are many others who we cannot ascertain. Out of 12078, 34 or less than 0.3% of them required oxygen supplementation. Most needed oxygen for 1 day, with the longest duration of 4 days for one patient. So compare Delta and Omicron. Delta, the numbers were 0.8% needing oxygen, 0.2% ICU, 0.2% die, altogether 1.3%. Omicron, so far, what we are seeing is less than 0.3% needing oxygen. Yeah, that's all. I should point out there is one senior in his 80s. He was admitted to, who infected with Omicron. He was admitted to ICU as he required high-flow oxygen. He was not intubated, and then he was given the oxygen and discharged from ICU the next day. So in the 20 days since the start of this year, today is the 21st of January, so the last 20 days, we have 9 days without any COVID-19 related deaths, 7 days with 1 death, and the rest of the days, 3 or fewer deaths. In terms of healthcare capacity, we now have 14 patients in our ICU, 14 COVID-related patients in our ICU, all due to Delta. We have about 300 patients occupying about a quarter of our 1,100 isolation beds, which we can ramp up to 2,500 at short notice. We have about 200 patients occupying 6% of our 3,200 COVID treatment facilities beds, which we can ramp up to 4,000 by the end of January and 5,000 by the end of February. All in all, we are in a good position now, but when cases start to rise further, we must expect ICU cases and deaths, ICU cases to rise and some deaths to happen. And healthcare capacity will also be filled up. But so far, our experience with Omicron is similar to other countries that encounter it before us. It is a less severe disease. Nevertheless, we need to be psychologically prepared for big infection numbers, 10,000, 15,000, maybe and probably more. And we all need to stay vigilant and do our part to get ourselves vaccinated and protect the vulnerable amongst us. And if the situation in our hospitals is stable, we should ride through the Omicron wave with the current safe management measures through Chinese New Year. In conclusion, I've earlier said that going through Omicron wave is like the game of snakes and ladders. It may set us back or it may take us forward. We will find out the answer quite soon. Whatever the outcome may be, we need to once again call on everyone to support our healthcare workers and do our part to ride through this wave. I will now hand the floor to DMS to talk about childhood vaccinations and elaborate on the changes to health protocols. Thank you.
Thank you very much, Minister. As of last night, the 20th of January 2022, there were nearly 9,900 persons with COVID-19 infection that were cared for in our dedicated hospitals and our community facilities, also in our home recovery program. And of this number, nearly 93% of cases were minimally symptomatic or well and were safely recovering at home, with a small number in the community isolation facilities. The remaining 5.4% of cases were admitted in our community treatment facilities, or CTFs, and in acute hospitals for higher equity care and monitoring. We've seen a steady increase in the numbers of community-based COVID-19 infections reported over the last week. About 76% of reported cases now comprise Omicron infections, which reflect the higher transmissibility of the Omicron variant, enabling it to outcompete against the Delta variant in the community. And we expect the number of cases to continue to rise. There should not be any doubt about this. We are presently in the midst of an Omicron wave, and we expect the community cases of COVID-19 infection and of the Omicron variant to continue to rise over the next few weeks. This is likely to continue into early February 2022, when the Lunar New Year period is upon us. We still have sufficient capacity within our CTFs and acute hospitals to accommodate more patients infected with COVID-19 infection. And even though the occupancy of the isolation beds that we have set aside for COVID-19 remains relatively low, we are watching the COVID-19 case trends very closely. And we've seen the situation evolve very rapidly in many other countries, dealing with their own Omicron wave of infections. And we note that even though Omicron infections are associated with less severe infections overall compared to the Delta variant, a less severe presentation does not imply that the situation is mild. When we see a very high total number of cases in the community, even a small percentage of more severe infections may mean a high absolute number of cases which require admission into the hospital for care. And this can easily overwhelm the existing bed capacity that we have within our hospitals. We have therefore placed all our hospitals back on standby to receive more COVID-19 admissions, and they are preparing to convert more beds as needed back to dedicated use for COVID-19 cases. The Minister has shared about the nearly 1,200 beds reserved for adult and pediatric patients with COVID-19. Our general ICU bed occupancy for both COVID-19 and non-COVID-19 patients remains healthy at 48%, with COVID-19 dedicated ICU bed occupancy at about 14%. We will step up our bed capacity for COVID-19 in tandem with our projections for the rising number of cases in the community. The clinicians have completed an initial review of their care processes and protocols for COVID-19, but we will continue to tweak these processes, particularly with regard to the management of patients with respiratory symptoms and who need to be tested to confirm whether they have COVID infections or not. Overall, fewer patients require admission for inpatient care for less severe COVID-19 infection, and they may be safely cared for in our community treatment facilities. So I expect the proportion of patients looked after in the CTFs to increase progressively over time. And for a start, with immediate effect, children aged 5 to 11 years may now be cared for in the CTFs, irrespective of their vaccination status. We have also rationalized the duration which COVID-19 infected persons need to be isolated within protocols 1 and 2. And this is in line with the shorter period of infectiousness associated with the Omicron variant. In studies conducted by NCID on patients with Omicron infection that were admitted for treatment, most vaccinated persons cleared their viral load over a shorter period of time compared to Delta infections. By the 7th day following infection, the CT values for PCR testing rose to a high level, suggesting that they were no longer infectious. NCID was also unable to culture viruses from samples collected from these patients by that time. The study results have allowed us to refine our isolation protocols and to shorten the maximum duration of isolation for vaccinated persons. So in minimally symptomatic persons who are fully vaccinated, the maximum isolation period will now be shortened from 10 days to 7 days. However, those who are as yet not fully vaccinated will still need to isolate for up to 14 days. And those recovering well may return to normal activities after that initial 72 hours of isolation and after testing negative via the antigen rapid test or ART. The hospitals have also reviewed their service continuity plans and are closely monitoring their staff numbers. We are mindful that in countries like Australia, the UK and the US, they have had high healthcare staff absenteeism rates due to their staff getting infected with COVID-19 when in the community. And this will lead to a severe degradation of healthcare and other essential services while these countries seek to manage the surge in their Omicron cases. Our hospitals have staff augmentation plans in place and will activate them if needed. The Ministry of Health will be working closely with these hospitals to ensure that there is no significant disruption of healthcare services. In our press release today, we have made a call to all businesses to do likewise, to ensure that their business continuity plans are in place, that they continue to ensure that SMMs are strictly adhered to at the workplace, and to encourage their workers to test themselves regularly so as to dampen community transmissions and to minimize operational disruptions. Raising our preparedness posture for COVID-19 once again does mean that our hospitals have to be careful in how much elective, non-urgent clinical treatments that can be provided within the hospitals. I seek the understanding of all Singaporeans that hospitals may again have to delay the scheduling of such non-urgent treatments at this time until we are confident that we are over the peak for Omicron cases in the community and when we can return beds in the hospitals to more elective clinical activity. To safeguard our healthcare capacity and protect vulnerable seniors as the community numbers of COVID-19 infection climb, we will be temporarily suspending in-person visits to the hospital wards and to residential care homes for 4 weeks from the 24th of January through to the 22nd of February 2022. We regret that this measure will inconvenience families who seek to visit and support their loved ones in hospital and in the homes. But this is to protect their health and welfare. We will review the need for these restrictions when the community situation is improving. Patients and residents in the homes may continue to connect with their loved ones using alternative means for communication, including through the use of the telephone and video calls. And as before, healthcare institutions will be allowed to exercise some discretion and adjust these restrictions for exceptional cases on a compassionate basis. We're watching the number of infections in children very carefully. These numbers have also risen steadily over the last week. For children less than 12 years of age, there were 312 cases reported yesterday, the 20th of January. And this contrasts with 120 cases reported 1 week earlier on the 13th of January. So this is more than double over a 1 week period. Yesterday, we saw more than 1,500 cases of children below the age of 12 years with either an active COVID-19 infection but who had not been vaccinated. The majority of these cases were in home recovery, but there were 43 of these children admitted into our hospitals and CTFs. This overall number of children below 12 years of age infected with COVID-19 is higher than the overall number of active COVID-19 cases above the age of 60 who have not yet fully recovered. So to put things into perspective, our children in this age group, in fact, are starting to form the majority of cases that are admitted into hospitals for care. Both KK Hospital and the National University Hospital also report that they're seeing more children with COVID and non-COVID related respiratory symptoms who require admission into the hospitals. Although Omicron is said to affect the upper airways more than the lower airways in infected people, with a lower rate of pneumonia setting in, children are very sensitive to inflammation in the upper airways, and this can cause wheezing and breathlessness. So more children with Omicron infections are being admitted for treatment, but thankfully, they do not require long hospital stays or ICU care. Nonetheless, the increase in admissions fills up the beds in our pediatric wards that are dedicated for COVID-19 infected children, and we are working closely with both hospitals to ensure there is sufficient bed capacity for the children. The situation is compounded by the increase in numbers of children with non-COVID related community respiratory infections, who also may require hospital care, and these children require initial isolation and testing to exclude COVID-19 during their admission. I looked at our local data of children less than 12 years of age who have been infected with COVID-19 from the 1st of October 2021 until the 16th of January 2022. And we saw 14,380 children with COVID-19. 4 children had severe infection needing either oxygen supplementation or ICU care. This corresponds to an incidence of 0.03% or 30 per 100,000 cases. There were 15 children in this group who developed multisystemic inflammatory syndrome in children, or MIC, and as you know, this is a late complication after recovering from active COVID-19 infection. It represents an incidence of 0.1% or 100 per 100,000 cases, which is even higher than that reported in some other earlier studies internationally. About half of these children needed ICU care. And if we consider all children who either had active COVID-19 infection or MIC, who needed oxygen supplementation or ICU care, the incidence was 0.76% or 76 cases per 100,000. The rate of severe COVID-19 infection in children or having a severe complication after COVID-19 infection is not trivial. And it's important for us to note that while infections in children are generally less severe than in adults, the infections are not mild. The children who need oxygen treatment or ICU care range in age from less than 1 year to 9 years old. All were unvaccinated. Now, with the National Vaccination Program, 3 out of 4 of them would have been eligible for vaccination. And this reinforces the need to better protect our children against COVID-19 and the risk of a bad outcome. We've launched our vaccination program for these children between 5 and 11 years of age, and we have seen a good take-up of vaccines so far. KK Hospital has shared its interim results from their study on the safety and efficacy of COVID-19 vaccination in children aged 5 to 11. All of the first 50 children that they reported vaccinated with the lowered dose of the Pfizer-BioNTech vaccine demonstrated a very good neutralizing antibody response. After the first dose, they demonstrated 64% antibodies against COVID-19 at 21 days later, and this increased to 96% after the second dose. This demonstrates that the primary vaccination course is effective in these children to stimulate the immune system to protect them against COVID-19 infection. The interim results also showed that the vaccination was safe. There were some reported reactions to vaccinations amongst these children, but they were all minor. They comprised local injection site pain, redness or swelling at the injection site, headaches and body aches, fever, and a small number of minor allergic reactions. None of the children needed medical consultation or hospitalization due to these reactions, and most of these reactions resolved within a few days. The reactions were much lower than in older adolescents who had received a higher dose of Pfizer-BioNTech vaccine. Separately, the Health Sciences Authority has released its latest safety update yesterday, looking at COVID-19 vaccinations in Singapore from the period until the 30th of December 2020, from that period until 31st of December 2021. So it's a full 12 months of data. And in the age group between 5 and 11 years, there were no reports of confirmed serious adverse events occurring after vaccination. 6 non-serious adverse events were reported to HSA, including minor allergic reactions like hives, some reports of dizziness, fever, and shortness of breath, which resolved spontaneously. In particular, there were no reports of myocarditis or pericarditis received since the commencement of our vaccination program for these children. And to date, nearly 13,000 doses have been given in this age group locally. So we are seeing that the lower dose formulations for the Pfizer-BioNTech vaccine that we are using is safe. This correlates very well with the experience internationally, for example in the US, where more than 9 million doses has been given. So when we weigh the risk of our children getting infected with COVID-19 and the risk of them getting a severe infection or late severe complication despite recovering from the infection, and we weigh that against the protective benefits of the vaccine and the lower risk of a side effect from the specially designed pediatric formulation of the Pfizer-BioNTech vaccine, the balance of consideration strongly supports letting our children between 5 and 11 years getting their vaccine. The Expert Committee for COVID-19 Vaccines, or EC19V, has also considered the need for protective enhancement against COVID-19 for children now from the ages of 12 to 17 years. As in adults, vaccination protection in these adolescents wanes with time, even if the protection against severe infections remains robust. This waning of protection against infection has been observed to take place by 6 months following their last vaccine dose, but at a more gradual rate compared to adults. The experience in Israel, the US, and the UK has shown that adolescents are as vulnerable to breakthrough infections following vaccination as in adults. But the booster vaccinations have been shown to increase the protection back against the Omicron variant. EC19V has therefore made a considered recommendation for booster vaccinations to be extended to this group of adolescents from 12 to 17 years. These children should receive their booster dose of the Pfizer-BioNTech vaccine as long as it has been 5 months or longer since their last dose of their primary vaccine course. The local and international data has shown that the safety profile and side effects for the booster dose is compatible with that for the first 2 doses, and with a significantly lower myocarditis risk compared to the primary course using the reduced booster dose of 30 micrograms. We therefore strongly encourage all parents to allow their children to get vaccinated and, when eligible, to undergo their booster vaccinations to better protect them against the Omicron variant and future variants of concern that may emerge over time. Thank you.
Good afternoon. As you heard from DMS and my fellow co-chairs, it is quite clear that the Omicron wave in Singapore has started. If you were to add the figures that we have been reporting up to now, the PCR positive cases, as well as the cases that test positive on the ART or the GP protocol 2, then we have around 3,000 cases now, and we expect to see cases rising even more sharply in the coming days. It is very likely that the peak of the Omicron wave will exceed previous peaks seen in the Delta wave. Minister Gan just now said it could be as high as 10 to 15,000 cases a day. That's very possible. In fact, it may well be higher than that. If you look at the experience in other countries, with the Omicron wave, they have an infection rate of about 400 infected persons per 100,000 persons. Now, if you translate that to Singapore's population, we are talking easily 20,000 to 25,000 infected cases a day. But as Minister Ong also reminded us just now, our focus shouldn't be the headline infection numbers. Our focus is really on the number of people who are severely ill and who need hospital or ICU care. And in that regard, we are hopeful that we can ride through this Omicron wave without having to tighten our measures. Because the experience so far is quite clear. People who are fully vaccinated, and if they were to get infected, the cases tend to be milder than Delta, and vast majority of them can follow Protocol 2 and recover from home, at home, without needing hospital care. So if this remains the case over the next few days and weeks, then this Omicron wave will not overly burden our healthcare system, and we can get through it based on our current safe management measures and our current posture. The risk is that we have to be prepared that many people will catch the virus, it will be quite widespread, and they will not be able to work for a few days. The cases will be mild, but there will be a high rate of absenteeism in the workforce. So this is quite unlike the Delta experience, where we had a very sharp impact, people needing hospital care, severely ill, and then it overloaded the hospitals and the ICUs. It may well be that Omicron is different. We will not have that kind of a sharp impact on the ICU system, but many more people get infected mild, but then there will be a high rate of absenteeism in the workforce, and potentially there will be an impact on business operations and essential services. And we have seen this happen in many other countries experiencing the Omicron waves. This is why personal responsibility is so important. We need everyone to do your part, uphold safe management measures wherever you go, and test yourself regularly. If you feel unwell, and even if it's just mild flu-like symptoms, please do not take any chances. Better to take precautions and work from home. If you can't work from home and if you have to go to the office and you say, I'm feeling quite all right, it's just a mild symptoms, then it's best to take an ART test to make sure you are not infectious before you go to the office. And in that way, even if one person were to catch the virus, it will not spread to others in the organization and result in a massive disruption in the entire organization. The same applies for our own personal and social interactions, especially with the upcoming Chinese New Year festivities. If you are feeling under the weather, please stay at home and rest, rather than go out and do New Year visitations. If you are planning to visit family members when seniors are present, you may want to take an ART test in advance to ensure that you are free from infection and you do not transmit the virus when you go out visiting. So if we all continue to exercise personal and social responsibility and we continue to do our part, we will be able to ride through this Omicron wave safely. And then we can look forward to our next bound of measures toward our continued journey of becoming a COVID-resilient nation. Thank you.
Questions from the media?
Okay, thank you, Ministers and DMS, for the very detailed remarks. Members of the media, as we have a limited time for the Q&A, do keep to just one question alone. Remember to use the raise hand function on Zoom if you would like to ask a question, and also a gentle reminder to speak slowly and clearly into your mic when asking your question. Okay, may we have the first question from Estes Timothy?
Thank you, Ministers and DMS. It seems like our posture for the past month has been one of bracing, waiting for the peak of the Omicron wave to hit us before relaxing restrictions, which makes sense. But how will we know that we've hit the peak? Are we waiting for daily cases to hit 15,000, which may or may not happen? Or is there another metric we're looking at? And what will happen to our measures when we hit the peak? Thank you.
Can you repeat the question? We couldn't hear you properly.
Can you speak slowly?
Sure.
It's
Because
also a bit soft,
intermittent.
whether you can turn up the volume a bit.
Timothy?
Hi, can you hear me?
Yeah.
Yes, thank you. So it seems like our posture for the past month has been one of bracing, waiting for the peak of the Omicron wave to hit us before relaxing restrictions. But how will we know that we have hit this peak? Are we waiting for daily cases to hit 15,000, which may or may not happen? Or is there another metric we're looking at? And what will happen to our measures when we hit the peak? Thank you.
The issue is not whether there is a peak of 15,000. We can never estimate what that peak is. But there is no doubt that there is a certain momentum in the infection rate. You can see it from the week-on-week infection ratio, which we track. And it's continuing to rise exponentially. So this will continue to go up. We are already in the midst of this rise, and we will continue to see it go up. And at some point, it will peak, as it did during the Delta wave, and then after that, it will come down. This is to be expected. We see this in other countries too that have passed the crest of the Omicron wave. Right? And we will go through that similar process. Rising, reaching a peak. We won't know exactly what that peak number is, but at some point, it will come down. So we are bracing indeed, as you say, for this wave. We don't think it is prudent or to relax or ease measures during this particular period. But once we have gotten through this wave and we have some confidence that the healthcare system is not overwhelmed, that indeed the vast majority of cases are mild, they will not take up hospital resources, and vast majority can recover at home, then we will have the ability and we will have some confidence to think ahead for the next bound of opening up and to continue our journey of relaxing our measures. So that's something we are thinking about, but let's not get ahead of ourselves. We are in the midst of a wave. So let's get through this wave first before we even think about the next bound.
Yeah, short comment. We get a lot of similar questions from media, from public, also in Parliament. And I think where such questions come from is like there's certain expectation that we have a plan. We plan out beforehand. On this day, on this time, we will do this, do that, based on certain metrics, and we will just proceed. But actually, we are in a fog of war. It doesn't quite work like that. Every variant is different and behave differently, and you just have to go through it, judge the situation, and make decisions along the way. That's how, in the middle of a crisis, that's how you make decisions. And we mentioned earlier, I used the analogy of a bicycle coming down a slope. You just have to keep juggling the three aspects: the healthcare capacity, your SMM, your vaccinations, and then juggle the three to make sure that you have the optimum combination of policies while you ride through the wave.
Thank you, Ministers. Once again, I'd like to remind media to keep to just one question, please, and to speak clearly into the mic. Next, could we have CNA's Sherlyn?
Hi, Ministers and DMS. Thanks for taking the question. Mine is about vaccination for children aged below 12.
Slowly, please. No way we can hear you here.
Sorry. My question is about vaccination for children aged below 12. Will boosters eventually be needed for them? And is there any possibility of using Sinovac, given Indonesia's and Hong Kong's move to approve them for kids?
Thank you very much for your question. First of all, we are focused at this point in time in rolling out and extending our primary vaccination for these children. That includes both the first and the second doses. There are no plans at this stage for booster doses following the primary course. We will monitor the situation closely to see if, as in other age groups, the vaccine protection wanes over time and whether it leads to an increased vulnerability to breakthrough infections arising, particularly in the setting of other viral variants that may emerge in the future. And at that point in time, we will make recommendations guided by EC19V on whether booster vaccinations are then required for this age group as in the other age groups. You've asked also about the Sinovac vaccine. At this point in time, the Sinovac vaccine is not approved for widespread use under the National Vaccination Program by the HSA. The approval for the Sinovac vaccine restricted its use to those above the age of 18. We've only used Sinovac below that age in very special purposes under public health programs in patients who had, in children who had contraindications to mRNA vaccines. So it's a very limited setting under close supervision, but not for widespread use under the National Vaccination Program at this stage. So the only vaccination, the only vaccine that is being offered for children below the age of 12 is the Pfizer-BioNTech vaccine, pediatric formulation, which is now available in Singapore.
Thank you, DMS. For the next question, can we hear from Taopao's Chipeng?
Hi, good afternoon, Ministers and DMS. This is Chipeng from Taopao. Would MTF consider further shortening the duration of stay-home notice and health risk warnings from 7 days to perhaps 5 days or lesser? Thank you.
I'll answer that. As I mentioned, one of our principles is guided by the science when we formulate our responses. So when we reduce 14 days from Alpha variant to 10 days to Delta, and then 10 days to 7 days for Omicron, all these were based on NCID studies of the viral load of different patients, at what point they can't cultivate the virus further. So it has to be guided by science.
One quick point, which is that, remember under Protocol 2, you isolate for 3 days, but after that you test daily, and if you test negative, you can already go out. So the time bound is 7 days, but because the viral load will vary from person to person, so if you happen to have a very mild case of infection, and you test yourself after 3 days, and you indeed the infection clears after the 3rd day, you can already go out, and it will be shorter than 7 days.
Thanks very much, Lawrence, for reminding us of that. So if I may just add a bit, and you read through the press release, it will try to explain this. Today, our Protocol 1 and 2, they are fixed tracks. From the beginning of diagnosis, you are put on Protocol 1, which is minimum, which is 10 days under Delta. Now we change to 7 days of isolation, or Protocol 2, which is 72 hours isolation, and after that, AG minus, you can come out and resume normal activities. What we have done now is allow smooth transition from one track to another. So you might be diagnosed and go into, say, a CTF 10 days or HRP 10 days. But along the way, can assess that actually you're low risk, your symptoms are mild, then you smoothly transit over to Protocol 2. After 3 days, 72 hours, you test AG minus, you can come out. So this is one change that we are now making to make the two tracks porous between the two.
If I may, I think I heard you asking whether or not SHN would be shortened from 7 days to 5 days. That's a slightly different situation, and that involves looking at the evidence for incubation periods as to whether or not incubation periods are now significantly shorter with Omicron that allows us to be more comfortable to reduce the period of observation and isolation for travelers coming in from overseas, which currently is pegged at 7 days for vaccinated people. While the Omicron variant is associated with shorter incubation periods, there's a range. It's a curve where you see, in fact, still some cases presenting with slightly longer incubation periods, even though the majority now have slightly shorter incubation periods compared to the Delta variant. But it's because of this tail where some of these travelers still have a longer incubation period. We've been reluctant to move our protocols from a 7-day SHN to a shorter one of 5 days or even less. But we will continue to watch this, watch the evolving evidence concerning incubation periods, and decide on the basis of the evidence whether or not a subsequent review in our protocols is needed. As of now, it stays at 7 days.
Okay, thank you, Ministers and DMS, for that. For the next question, could we hear from Bloomberg's Faris?
Hi, Ministers. Nice to see you. I guess the public would want, something to
Sorry,
handle.
Faris, it's a bit unclear. Could you speak louder and clearer?
Can you hear me?
Yes.
Is this clearer?
I hope
Yes,
so.
Minister, just one question. Once this wave is over, what are the possible next few steps of reopening? And at which point do you think that we can get there? Is there like a timeline that the public can have a handle?
We will take with just one question. Thank you.
Thanks. I think this is similar to the first question. And the answer is, it's too early to say. Let's get through this wave first, and then in due course, we will talk about the next steps after that. But let's not get ahead of ourselves now when we have not even reached the peak of the present wave.
I must add that we don't really know when the peak will come and when the peak will be over. So we have to continue to watch the number of cases every day, look at the rate at which the number of cases rises, and at the same time, keep an eye on the healthcare facilities, making sure that our facilities are not overwhelmed, particularly our ICU, our critical care facilities, to ensure that we are able to cope with the number of cases. And then once we get over the wave, we will see the number coming down. Then the week-on-week increase will then go to 1 or eventually come down to negative when the number of cases come down. Then we can think about how we can adjust our measures going forward.
Maybe just to point you in some directions, if you look at South Africa, it took them about 4 weeks to crest, and then cases have been coming down since, quite sharply as well. UK, US takes about 4 to 6 weeks to crest. Omicron is so transmissible. So when the numbers are so huge, at some point it runs out of people to infect, and then it will start to come down. So these are what other countries have gone through, but every country is different. Some has a lot of prior infections. They have different levels of vaccinations. So depending on circumstances. But I think some of these countries are reference points that we are watching closely.
Thank you, Ministers and DMS, for that. For the next question, could we hear from Today, Nabila?
Hi, thanks for taking my question. It's just on healthcare workers with, the expected strain on the healthcare system. I just want to know if there's a possibility that their overseas leave will again be suspended this year.
Thank you very much for the question. It was a good opportunity over the last few months for healthcare workers to go on leave, get the needed rest they required after long hours working in the hospitals. And for some, a precious opportunity was provided for them to meet up again with their loved ones. At this point in time, we're continuing to watch the situation, and certainly if the numbers in the hospitals continue to rise, and if there's a potential overwhelming of healthcare resources with an increase in manpower absenteeism, the hospitals may have to review and adjust their leave policies. But at this point in time, we have not adjusted the leave policies beyond since December last year. So there are people who can still take local leave. They are on exceptional and compassionate grounds, those who will travel overseas to visit their families. But we're watching this closely. The hospitals are keeping track on the manpower that's going on leave. They're not available in Singapore to provide and support clinical services. And if the number of cases in the hospitals go up, then their leave policies may change.
But thank you for asking that question and thinking of our healthcare workers. Their welfare, their morale, absolutely important. And through the Delta wave, we knew that they really had it tough, but worked together, driven by their sense of public mission, put themselves in harm's way, went through a lot, sacrificed leave, and then uphold the system. And we went through the Delta wave, and they contributed a lot. So likewise, for Omicron wave, we hope it's not as acute as the Delta wave in terms of pressure on the healthcare system, but we don't know, we have to watch. But our healthcare workers know the impending challenge, and they will need all our support. So let's continue to cheer them on, continue to give them our moral support.
I think the best support we can do is to observe all the SMMs that we have put in place, be socially responsible, reduce the risk of transmission, and lower the risk, the stress on the healthcare system, so that we will have a sufficient capacity, and the healthcare workers will then be able to cope with the cases that we see every day. Thanks.
And take your vaccines. Every healthcare worker, when they see the workload building up, ICU beds filling up, and mostly by unvaccinated people, they all ask the same question: why didn't they vaccinate themselves? Could have avoided that. So vaccinate yourself to support them.
Thank you, Ministers and DMS. We have time for one last question. Could we hear from Channel 8's...
I think it's okay. We can take a few more.
Okay, so the next question will come from Channel 8's Su Xuan.
Thank you, moderator. I'm just going to get one Chinese soundbite.
Sorry, Su Xuan, could you speak louder and into the mic?
Thank you for taking my question. Good afternoon, Ministers and DMS. Can I request a Chinese soundbite on the upcoming Chinese New Year festive season? So it is very likely that individuals will be visiting households with elderly around. In this case, will self-test before visit made mandatory? And my question is on the business BCP. So in today's press release, right, business are advised to ensure split team arrangement continue to be in place. Does this actually contradict to the relaxation earlier this month, where more workers are actually allowed to return to the office? Thanks.
I can answer the second question on the business continuity. I think the question was whether this contradicts our measure to allow workers to return to work. Is that the question? Yes. Yeah, okay. So I think to allow workers to return to work is necessary, because working from home, while it is desirable from a public health point of view, it is disruption to many of the business operations, and many companies, enterprises have fed back to us that they require their workers to go back to work as much as possible, while we have to strike a balance, and that is why we allow some workers to return, and we have adjusted our work from home policy. But despite the fact that we allow workers to go back to work, we continue to insist that the offices, the business, the employers will have to put in place the appropriate safe management measures at the workplaces to minimize the risk of transmission. And workers should also test themselves regularly to protect themselves as well as to protect their fellow workers. This way, we will then ensure that business continuity is preserved. At the same time, businesses are also encouraged to put in place business continuity plans, including alternative teams, including backup systems, as well as to look at some critical supplies, because your own business may be able to continue to operate, but if your suppliers are disrupted, you will also have a problem, particularly for manufacturing plants, for example. They will have to ensure that there are critical, essential supplies, raw materials, and components are available, and therefore the entire supply chain has to be looked at. MTI has been working with our key industries, essential services, to put in place and to strengthen business continuity plans. But we also have to bear in mind that at the peak of the wave, as I mentioned earlier, if we have a 15,000 or 20,000 or 25,000 or more, as Minister Wong pointed out, there will be disruptions, temporary disruptions to some services. And we hope Singaporeans will understand and bear with us, and we'll work together to get over this wave.
Sorry, what's the Chinese soundbite that you asked for? Oh, on Chinese New Year visit. Oh, okay. 我大概的跟你解释一下。我也不要单单只讲农历新年的事，大概解释一下今天我们的一些重要宣布。这个奥密克戎的这个疫波会相当的大，病例呢最高峰的时候可能会很高，可能比我们想象中还高，可能超过1万，可能超过15000，甚至更高，所以我们要有一些心理准备。但是呢，我们刚刚遇到冠病的时候，就是像一群不会游泳的人呢。看到水就怕，看到海水也怕，看到河水也怕，看到游泳池也怕。但是现在情况不一样了，不要看到水就怕，不要看到高病例就觉得担心、觉得害怕。现在我们可以问问，这个水有多深？达尔他病毒的时候，这个病情相当严重。如果你没有接种疫苗而得到达尔他病株的时候，很多人得到严重的疾病。奥密克戎呢，从全世界的观察，我们的观察，还有现在本地的观察，的确是一个比较不严重的这个疾病。这个水没有那么深，你不会游泳，你进了水，可能水到你的膝盖，到你的腰，最多到你的胸部，不至于会淹死。所以这个水我们不需要太过害怕，要谨慎，但是不需要恐慌，不需要害怕。高病例不等于说我们没有办法应付。第二个问题就要问自己：我们现在会游泳吗？当时去年、前年的时候，我们是不会游泳的。现在我们打好了疫苗，我们会游泳了，而且会游泳的人会帮助那些不会游泳的人。所以情况也是不一样了，所以我们是非常谨慎，但是充满的有一些乐观的态度，来抵抗这个病毒的这个疫波。说回还是最基本的态度：冷静观察，稳住阵脚，沉着应对。但是不可以轻敌。如果很多病例的话，一小部分的病例得到严重疾病，也会使我们的医疗体制施很多的压力。严金勇部长也说过，很多病例的时候，很多基本服务也会人手不够，大家到时也要见谅，要请大家多多见谅。所以我们在农历新年的时候，也要用这个态度度过我们的这个农历新年。我们要通过这个疫波，就刚才我们所说的，观察这个疫波对我们的医疗体制跟基本服务的这个打击。如果说医院情况保持稳定，我们就可以维持目前的安全管理措施，在农历新年期间度过这个疫情，不需要绑紧，希望不需要绑紧。所以现在真的是一个，但是说来说去，度过了这个疫波，疫情还没有过，这是一个全世界的疫情。只要某某国家还没有打疫苗，还不够人打疫苗，就有可能会有新的病株。新的病株就是一个新的威胁，会一个让我们前功尽弃的威胁。所以很重要的是，现在不止新加坡每个人需要打疫苗， 全世界每个国家都要尽自己的力，每个区域要尽自己的力，是全世界的人能够打疫苗，才不会有新的病株再出现，让我们前功尽弃。所以这真是一个匹夫有责的一个项目，一个匹夫有责的一个行动，不只是每个国人，其实是人类每一个人都需要做的。
Thank you, ministers, for that. For the last question, we will take it from Reuters. Chen Lin.
Hi, Minister. I would like to ask if the MTF has considered to go ahead and reopen further regardless, because it's also uncertain whether new variants could emerge anytime. And also based on your reply earlier, is it
Chen Lin,
right to
we'll take
assume that
just
the
one
MTF will
question.
give a
Thank
clearer
you.
direction
Chen
on
Lin, we'll
the
take
next
just one
4
question.
weeks?
Thank you.
What's the question?
As in, has the MTF considered to go ahead and reopen further regardless, as it's also uncertain whether new variants could emerge anytime? And based on your reply earlier, is it right to assume that the MTF will give a clearer...
Thank you, Chen Lin.
Okay, I'm not sure how many times I have to answer the same question asked in repeated variants, no pun intended. But it's a variant of the same question asked firstly by the first question, I think by Faris Bloomberg as well. And now a similar question, are we going to reopen regardless? Well, as I said, we intend to get through this wave. We are hopeful that we can do so with our current posture, given our assessment of the situation up to now. But there is still uncertainty in the coming days and weeks. We don't know how many cases, we don't know how big the wave will be, and we don't know exactly what the impact will be on our healthcare system, or even on the broader issue of potentially a high rate of absenteeism and disruption on business operations. And that disruption can easily take place not just for businesses, but even for essential services, including healthcare. So a lot of things that we have to watch out for in the coming weeks, and we want to get through that before we contemplate any further moves to relax or to reopen further. And that would apply, be it at the borders or with our own local community measures. Of course, if you look at the overall trends, and if things continue as they have been, there is a chance that any future mutations of the virus will continue in this same direction. In other words, it gets milder and it becomes more like a flu. And if this is indeed the direction in which the virus mutates, I think that's good for everyone around the world. Then we are moving toward the direction of the end of the pandemic, and it truly becomes an endemic disease, yet another coronavirus that the world will have to live with, but it's more like a bad flu once you catch it. But it's too early to tell if this is indeed the way the virus will mutate, and it may not go in a straight line. There will be curveballs. You can never tell how things will pan out. And as Minister Ong said just now, a key consideration is that we really need the world to be vaccinated. So long as there are large segments of population around the world remaining unvaccinated, the risk of mutation remains, and you never know what the next variant will look like. So that's our overall posture. There are still uncertainties in the coming year, or for the rest of the year, but we are quietly confident and hopeful that we can continue with our path of reopening, of this continuing on this journey to becoming a more COVID-resilient nation, because of all the measures we have taken, and also because we have been able to vaccinate a large majority of our people.
I think it is important for us to acknowledge that we are in the midst of an Omicron wave, and the wave is how big it is, when it will peak, and when it will subside, we don't really know. We have to watch and we have to monitor very closely. And we also understand that many Singaporeans are quite fatigued about the COVID-19, and all of us are very eager to get to the end, get over with it and get to the end, and hopefully we reach endemic city soon. But I would advise that we have to exercise caution. We can't rush these things. At the moment, because we are confronting with this major wave that is coming our way, we have to prepare ourselves for the impact of this wave, particularly on the healthcare system, to ensure that we reduce the stress on the healthcare system so that they are able to cope with this wave. And after that, we will then take a review and decide what our next steps be. And we also have to continue to prepare for new waves that may come, new variants that may come along. But we also have to accept that with every wave, every variant, we learn a little bit more about the virus, and we have a little bit more tools in our hands to fight the virus and to combat this pandemic. And even today, we have vaccines that are very effective, and we have booster programs that we have rolled out. So the key is focus on getting our people vaccinated and boosted, and at the same time, observe the SMMs that we have put in place to keep everyone safe as much as possible.
Maybe I join in and provide a variant to the answer as well. And again, to point to some facts, and that there are still countries and regions in the world very tight COVID-0 policy and unable to open up, at least not for travel. And then there are other places we see where overshot. When a Delta wave is over or previous waves over, open up, and then new waves come, and then they throttle back. We have our fair share of that as well, but by and large, if you look at the facts and what actions different places have taken, we are always in the middle path. And I think it's tiring, but on the other hand, we made progress. As I explained before, 2020, when we have clusters, double-digit clusters, we went into a lockdown, circuit breaker for 2 months. Last year, 2021, when we had big Delta wave, we went to 2-person groupings. And this year, with Omicron wave, we are quietly hopeful that we can go through this wave with the current posture, which I think allow most of us to carry on our normal lives, carry on our life quite normally. And after this wave, there's no doubt we will be even more resilient. And then, as my colleagues have said, we can then contemplate how to proceed from there.